So today I'll be discussing about PCOS or PCOD. So the most common question that everyone asks is whether PCOD and PCOS are two different things or whether it's the same thing. So it is the same thing basically. It's like rain, Varsha and Barish. They are the same things, right? So similarly PCOD or PCOS is the two different names given to the same thing. So it is polycystic ovarian syndrome or polycystic ovarian disorder. Okay. So polycystic ovaries, it means that your ovaries have multiple small cysts and this leads to more male hormone production in females. So it is basically a disease that is almost limited to females, and there are small follicles inside the ovary and there is male hormone production, that is male hormone is testosterone. That is normally also produced but in very less amounts in females. In this disease, it is produced in more amounts in females, so that leads to all the problems. So what are the symptoms? How will you know whether you have PCOS or not? So what we say is there are three main things. One is presence of hair growth. So if you have thick hair, that is beard like hair over your facial area, that is over your mustache area, over here chin, on the cheeks, or over your chest, abdomen, back, arms, this hair if it is thick. And a lot of people say that previously it used to be thin but now it is becoming thick, or previously I used to remove it with threading maybe once every month, now I have to do it once every week or once every 2 weeks because it grows very fast. So if something like this is happening to you, that your hair growth is increasing and you have to and it is increasing much more than previously, then that could be a sign that you could be having PCOD or PCOS. Another thing is if you have irregular periods. So normally the normal cycle duration is 21 to 35 days. So if you are having period between this interval and it is fairly constant, then it is okay. But some people have periods once in every 2 months, once in every 3 months. Some people don't have periods for 4-5 months also. So if this is happening and previously your periods were irregular, or for a lot of people the periods will be irregular from the beginning itself, so then this is one more symptom that you should consult an endocrinologist to know whether you have PCOD or not. Again, if these two things and exclusion of some other hormonal disorders, I will talk about that. If those other hormonal disorders are not there and two of these things are there, then we say that you have PCOD or PCOS. So what other things other than hair growth over the face or other than irregular periods, you can have more weight gain as compared to others. So if you have more weight gain, if you have darkening around the back of the neck, you must have noticed in a lot of people. So if that is there, if you have infertility, if you are trying to conceive since a long time and you are unable to conceive, these are other things that can happen. Again, for PCOD patients, it is very common. They have more chances of having diabetes, more chances of having depression. So these are the other symptoms that can happen in PCOD. Again, these symptoms can be there for many other hormone disorders also. Same symptoms can happen if your thyroid hormones are low. Same symptoms can happen if your prolactin, that is one more hormone in the body, if it is more. Same symptoms can happen if you have if you are fat, and that can also cause same symptoms. Again, if there is one more hormone in the body which is called cortisol, so if that is more, or if there is some other disorder, another problem in your ovary or another gland called adrenal gland. So these hormonal imbalances can mimic PCOS. So that is why there comes a need to visit an endocrinologist specifically for PCOD. Because we have to rule out, we have to check your thyroid levels and see whether you have thyroid problem or not. Because if you have thyroid problem which is untreated and you don't even know that you have, same symptoms can happen and you can be wrongly labeled as PCOD. So if we just correct your thyroid problem, all these other problems will get solved. So thyroid, prolactin, some other tests we need to do to completely know whether you have PCOD or whether these symptoms are due to those other hormonal imbalances.